Praise the Lord, everyone. My name is Antoinette Lawson. I'm a consultant with Dr. Tracy Lynn Jewelry, bringing exquisite jewelry for exquisite women. If you'd like to get in touch with me, please contact me at 917-387-5530, or you can go to the website at www.tracylynnjewelry.com/sexy as she wanna be. I can also style your wardrobe or come to you as well. So if you see any of the pieces that I have on the table and you're an exquisite woman and you would like some exquisite jewelry, make sure you give me a call. Thank you and have a blessed day.
Hi, my name is Rose Smith and I'm a proud supporter of KLGN TV. And you are watching The Road to Kingdom Living with Apostle Shawanda Cunningham. God bless you.
All right.
Welcome, everyone. Thank you for joining us. And my name is Dr. Maxelle D'Oily, and I have two special guests with me. I've known these ladies for a little while. And welcome to The Road to Kingdom Living on KLGN TV. First, I'd like to have Dr. Marva introduce herself and give you a little bit of background where she works in terms of the specialty.
Hello everybody, my name is Dr. Marva Edwards Marshall. I'm a nurse practitioner and I specialize in adult and geriatric care. I currently work in long-term care, managing the care of our elderly patients and patients with chronic disabilities.
Okay. Welcome. I'm so glad you're here with us tonight.
Thank
you.
Good evening. I am so pleased to be here with you this evening. My name is Marsha Wells. I work for Fresenius Kidney Care as a kidney care advocate, and I've been doing that job with them for 6 years.
Can you tell us, what does a kidney care specialist do?
My job is to educate patients who have been diagnosed with chronic kidney disease, and that is because they have either diabetes or high blood pressure. And one of the things that I do is schedule classes with them and provide information to them about chronic kidney disease so that prior to the need for them to have treatment, they are very well informed about the treatment options that they have available to them.
Okay, thank you so very much. As we can tell, diabetes and hypertension are two of the main chronic diseases that will lead to kidney failure. And of course, we need our kidneys to function, don't we?
Yes.
We know what the kidneys do. They filter, they take care of the waste products within your body. It works in helping to manage your blood pressure and all of those things. So when the kidney doesn't function, then your body becomes very toxic because the body is not able to eliminate waste. And it needs to work very efficiently. Otherwise, we run into a lot of healthcare related problems. And Ms. Marsha, let me ask you, I know your names are similar, there's Marsha and Marva, but Ms. Marsha, let me ask you, what are some of the signs and symptoms that a person who has end-stage kidney disease, when we say end-stage, we're talking about the kidneys, they're just kind of working like as slow as molasses to actually doing absolutely nothing. What are some of the signs and symptoms? Because I realize that the general population may have issues and they're headed that way, but they may not know it until they actually get there. Because some of the early symptoms may be overlooked, and by the time they're told they're in end-stage kidney disease, it's really, how did this happen? What did we miss? What are some of the signs and symptoms of chronic kidney disease that the general population needs to be aware of?
One of the things that is so interesting about chronic kidney disease is that the symptoms don't tend to reveal themselves until the later stages of the disease. That's why many people walk around with chronic kidney disease and don't know that they have it. Some of the symptoms that you might experience as the disease progresses are nausea, vomiting, trouble concentrating, difficulty sleeping, swelling of the hands and feet, difficulty breathing. There are many symptoms, but they tend not to reveal themselves until you move closer to what is called end-stage renal disease.
Thank you so very much. Can I ask you another question? I'll make a statement and then I'll ask you a question. With the kidney disease, one of the things that is overlooked in the general population is if you're spilling protein in your urine. So it's very important that when you go to the doctor and you get your urine test done, one of the questions you want to ask is there protein in my urine? Because protein is a very large molecule and it's not supposed to be filtered through the kidneys. And so sometimes even in minute amount of protein in the urine, that will tell you you could be headed for problems down the road. It's just one of those symptoms that unless you ask, or because you're not going to have any of the symptoms she talked about earlier. So unless you ask, am I spilling protein in my urine? And that's a very important thing to ask. So what are the options that are available to the general population once they start having some of these signs and symptoms? What should they do?
There are at least 5 options that people have as it relates to treatment for chronic kidney disease or when you get to end-stage renal disease. But I'd like to make a point before I talk about that, because what's important about the protein is that usually chronic kidney disease is detected in your abnormal lab result. And that is because one of those first symptoms that you would not be necessarily aware of unless you talk to your doctor, which should be a nephrologist, that's one of the first signs that there is something that's wrong with your kidneys. So like Dr. Doyle said, the lab work is going to indicate that something is wrong long before you ever have any feelings about it, and that is the protein. That usually happens in stage 3. And in stage 3 of chronic kidney disease, that is when they see that your kidneys are functioning less than 60%. That's when you really should be referred to a nephrologist so that they can monitor you and help you before you get to stage 5. Once you get to stage 5 and you have end-stage renal disease, that is the time that you need to seek treatment. And the options that are available to you are at-home peritoneal dialysis. That is the dialysis that you do in the comfort and privacy of your own home. And the way that that works is that your blood is filtered naturally. It's filtered naturally by using the blood vessels in your abdomen.
Yeah, and you're right, because any of you here studied chemistry and remember osmosis and diffusion and all of those things? Well, let me tell you, there is a place for it. It's not just something you study in school, because the blood is so toxic that the peritoneal cavity, there's a sheet that goes over the organs in your belly, and that acts as a membrane so that the toxin can move from the blood into the abdomen, into the fluid that you put in the abdomen, and then you can drain that out. Okay, so we'll hold on the other treatments for a little while. Peritoneal dialysis is an effective treatment, but just to let you know that your kidneys, even when you're in dialysis, dialysis only takes care of, I think, 10 to 20% of what your normal kidneys would do naturally. Is that
Yes.
correct? Yeah, about 10 to 20%. So therefore, you're 80% behind the eighth ball, even if you're on dialysis. So people think that dialysis is a cure. It is not a cure. Okay? All right. Dr. Marshall, you're going to talk a little bit about arthritis.
Yes.
And it's a very prevalent illness within or disease or diagnosis within our society, especially among the aged population. There are more than one types of arthritis. Can you shed some light on it to help us differentiate one and the other?
Sure. First
Look
off,
at the camera.
Arthritis affects 1 in 4 U.S. adults. And it is the most common chronic disease that affects adults in this nation. Arthritis comes in different types of arthritis, up to maybe around 100 forms of arthritis. However, the most common form of arthritis is osteoarthritis, and this is what we will see with in the community more often than any other type of arthritis. The symptoms that is exhibited with osteoarthritis is pain in the joint, swelling of the joint, and stiffness. These are some of the first signs that individuals will experience. So, when these symptoms occur, it is the duty or the responsibility of the individual to seek medical advice regarding what treatments can be applied for this condition, because it can lead to disability the longer it's left untreated. So the cause of it is really not known, why people get osteoarthritis. However, it is related to or associated with genetics or hereditary. If you have a parent or a brother who may have osteoarthritis, you may be affected by it, and when the subtle symptoms occur, it is appropriate to have that dialogue with your physician, your primary care provider or your healthcare provider, and tell them the symptoms and also inform them about the possible genetic component to that. The other, another cause or indication for osteoarthritis is age. The longer we live and the older we get and we wear and tear, use your joints more, cooking, baking, walking, running, jumping, all that stuff, is wear and tear of the joints, and arthritis may occur. Also, it affects athletes because they do a lot of activities and put a lot of strain on the joints, which can wear away the cartilage that protects the joints. Also, obesity is another factor for getting arthritis or osteoarthritis, because the strain and pressure that is put on the joints because of the weight. Our bodies weren't designed to have a lot of weight put on our joints. And also trauma can cause individuals to have osteoarthritis over a period of years.
Thank you so very much. That was very informative. It's very informative information for us to have. One of the things about chronic diseases is that the symptoms are not always visible. And so you'll see somebody dressed up nicely in their makeup going about their business, and you think all is well. And because it's such the invisibility, you may not know that they're having a lot of pain. You may not know that their capacity has been reduced, that their ability to function normally has been reduced and is being reduced. And you don't even know that their quality of life is actually being affected. All you see is someone that looks good, seems to move well, seems to be coping with a situation, and you may have no idea. So sometimes people with chronic diseases, they look very normal, except when they probably say, I'm in pain, or I'm tired, or I need to take a nap, or they've changed their social status where they don't want to hang around with people anymore because they need more rest time, or they cut their work schedule down. All of these things you will see, but you will not correlate it with the fact that they're really having some major problems. So it's an invisible type of disease until it gets to the point where it is very, very debilitating, or in a chronic stage or end stage, as you have mentioned with the kidneys. Okay. Now, you had talked about peritoneal dialysis as one option. And for peritoneal dialysis, what they do is they put a little tube in your abdomen. You hook up all the treatments, which is a lot of fluids that have all kinds of stuff in it. And then you open it up, it goes into your belly. You let it stay there for several hours. And after a while, you drain it out and you redo it again over and over and over again. And most people have the ability to do it at home. It is somewhat risky because if they don't use very clean procedures and how they handle both the site and the fluids, they can end up with very serious problems. One such as peritonitis, where you'll have infection that you've introduced into the belly system. And that's very, very dangerous, and many people have lost their lives as a result of that, because that infection spreads very quickly, very, very quickly, and it can be very deadly. So that's the peritoneal dialysis. What other options are available?
There's also in-center hemodialysis, which is done in a dialysis clinic. There are trained staff who perform your dialysis treatments for you. And with hemodialysis, you have to be connected to what's called an artificial kidney or dialyzer. And then there is a needle that's inserted into your access site where the blood is then filtered through that dialyzer and returned to your body. You can do in-center hemodialysis, and that is another form of dialysis that you can also do at home with a training partner.
Yes, the hemodialysis is, when all the blood that's in your system goes through and gets filtered, and hopefully some of the waste comes out, so that you can stay alive. It's very, very important to do that. It's not without its own complications too. So everything that is available has complications. And so that's why you need to have skilled professionals actually doing the care, or be taught how to do the care yourself. And I know, like for hemodialysis, it is required that you have another partner at home when you do the home dialysis. It can be done at home as well as in the center, but of course you need a lot of training because you have your body exposed and there's blood, and you want to make sure that you don't bleed out. So that's very important to do that. And we see people all the time with the shunts in their arm. Have you seen people that have big arms and you see all the puffiness there? That's where they have their shunt, and that's where they hook them up. Ms. Marva, what are some of the treatments that are available for arthritic patients today?
The most significant and severe symptom for osteoarthritis is pain. And pain causes the debility or disability because when people have pain, they don't want to move. So they tend to sit around, and you guys have heard the saying, if you don't use it, you will lose it. And essentially that is what occurs. So you're in pain, you haven't discussed it with your physician or your healthcare provider, and you don't have adequate pain control, so you're not gonna move around. So you're gonna sit there and your muscles start wasting, because your muscle wasting and you do have the weakness and you don't wanna walk around, so now you're immobile, and that immobility can lead to contracture, so now you're totally disabled. In an effort to prevent that from occurring, when the symptoms of pain starts appearing with swelling of the joints and stiffness, it is the time to have that discussion with your healthcare provider about what is going on so adequate pain management can be initiated. There are medications that can be used to relieve the symptoms. However, your healthcare provider will make the determination which is the best course of action or medication to use based on your chronic condition or your age, because there are some medications that cannot be used with certain age and chronic conditions. Also, getting into an exercise program helps a lot with keeping the joints active and mobile. As I said, pain management first. As long as you have adequate pain management, you can do all the rest. Get into activity, exercise program. The other thing is, if you're obese, then you need to see a nutritionist, lose the weight so that the pressure on the joints are not significant, where will cause a debility. Even with the pain medication, if you still have, are overweight, you will still have the problem with the pain. The other things that can be used are cane, which relieves about 60% of the pressure that is put on the joint that is affected. Also, heat can be applied to the joints as well. However, before any of these interventions are applied on an individual basis, it needs to be discussed with the healthcare provider, who will make the determination which is the best course of action, what is the best type of medication, what is the best exercise program, have therapy to work with the individual so that they can use the cane appropriately, because I see some people walking around with cane really don't know how to use it, so that has to be done. And also how to apply the heat to the joint so that you don't get burned.
Wonderful. Wonderful information. Wonderful information. And of course, one of the things that we sometimes overlook is the fact that people that are suffering from chronic illnesses, they have emotional issues. There is the grief that they have to deal with not being able to function to the capacity that they're used to. Then there is depression that can come in. And then there is the disability that may result from them not being able to work. They may look good, but they're not able to function in that capacity. They may not be able to fulfill some of the roles that they're used to. So there are a lot of losses that a person experiences with chronic illnesses. So they need a lot of support and also a lot of prayer, and so we want to ask the Lord for healing for individuals that are suffering with chronic diseases. There's also sometimes a lot of guilt associated with it, especially if you're the one responsible for the excessive eating and not being able to or willing to lose some of the weight. All of those issues come into place. So it's not easy for anyone that has chronic disease, even though they may look absolutely wonderful, but their functionality has been decreased very, very significantly. And usually these two diseases become progressively worse. So you may have times when everything is well and they look well and they're doing well and the pain is controlled. Then you'll have flare-ups and then sometimes it can be very debilitating. Can you talk, we have 1 minute left, so can you touch on some of the other treatments? If you would just address transplants, I would appreciate that.
Transplant is one of the other options that you have available to you with chronic kidney disease. A transplant means that you are having a healthy kidney placed inside of you. You only need one in order to live, as far as your other 2 kidneys are concerned. You only need the one for the transplant. It requires there are requirements involved as far as your overall health, and you have to have a donor match in order for that transplant to take place. You have to be evaluated basically to see if you're eligible for a transplant.
Thank you so much. The transplant can come from a relative, from a friend, or from someone who's deceased. Whenever, like, there's an automobile accident and in the emergency room, there'll be somebody there from the transplant team to try and harvest an organ. When a person is deceased, at least 80 people can have some life-saving results from all the organs. You've got lungs and hearts and kidneys and everything else. And I hope you come back sometime to talk about transplant, because there's a lot involved in it, and we have a lot of issues, especially with the minority population. I want to thank my guest for being here. Let's give a round of applause for Dr. Marva Marshall and Marshall Wills. Thank you so very much, and have a great afternoon.